Hello everyone, I'm here with Adrian Guzman, Director of Policy and External Relations at the New York City Department of Health and Mental Hygiene, and we're here to talk about some of the regulatory changes that New York State made to expand access to PrEP for youth and adolescents. So Adrian, could you tell us a little bit about some of the changes that New York State made?
Sure. First, thank you so much for the opportunity to share all of the exciting work that we've seen in New York State in the last couple of years. I think the beginning of this particular story can start probably in 2015 when the governor released our blueprint for ending the epidemic. It was a set of recommendations that were developed by community members, government officials, and providers, including youth providers, to expand upon his 2014 plan to end the epidemic. And that 2014 plan had three prongs. The first being to identify people with HIV who remain undiagnosed and link them to care. Second, to link and retain people diagnosed with HIV in care to maximize viral suppression so that they remain healthy and prevent further transmission. And third, and most relevant here, is to provide access to PrEP for people at high risk for HIV infection. So I should mention that at this time in 2015, minors in New York State had only the explicit right to consent to HIV testing without involving their parent or guardian. They had to involve their parent or guardian with regards to HIV prevention services or HIV treatment. So this is obviously a problem for many reasons. And part of the New York State Ending the Epidemic Blueprint was to address this sort of legal loophole. And one of the recommendations in the blueprint was our Getting to Zero recommendation number 27, which recommended that we enact policy changes to guarantee minors the right to consent to HIV and STI treatment, diagnosis, prevention, and prophylaxis, including sexual health-related immunization. So following that, in fall of 2015, the New York State Health Department convened the first ever statewide forum on adolescent PrEP implementation. This brought together providers, members of the public health officials, community members to discuss successes to date regarding delivering PrEP to young people, as well as the challenges that exist to really implementing this widely and to the young people who are most in need of this. So following that, in 2016, the New York State Assembly and Senate introduced a whole package of legislation. We sort of refer to it as the Ending the Epidemic legislation, and it, among other things, set forth four proposals. One, to enact legislation to streamline HIV testing by removing informed consent and replacing it with the minimum requirement that patients be advised that a test is to be performed. It also proposed to remove the upper age limit for offering an HIV test so that anyone over the age of 13 should be offered a test in certain settings. And we also expanded access to STI testing and PrEP by allowing, respectively, physicians and nurse practitioners to issue non-patient specific orders to nurses to screen for people at risk for syphilis, gonorrhea, and chlamydia, and pharmacists to dispense up to 7 days of PrEP. But what's missing in that package of legislation? There was no legislative proposal that set forth legislation to expand the right to consent to prophylaxis and treatment to minors. So the advocates and the public health departments, we had a decision to make whether we wanted to wait until the next legislative session to reintroduce legislation focusing on access to PrEP and treatment for young people, or if we wanted to go another route. And we essentially opted to go the latter route, and that was to explore what we can do in the regulations in our state sanitary code. So after Governor Cuomo signed into law those pieces of legislation I mentioned, the following year, almost immediately after the laws were signed by the governor, the New York State Department of Health proposed to amend our state sanitary code, our health code, to add HIV as a Group B STD. So I should back up and say that up until this point in New York State, HIV was never classified as an STD. HIV had its own separate set of laws, and that was for a number of reasons, obviously for stronger confidentiality protections and for record keeping and things of that nature. But unfortunately, that also meant that without being an STD, HIV didn't have attached to it certain obligations by the local health department and certain rights to access for young people. So after a public comment period in which the New York City Health Department strongly supported the proposed regulatory changes, the state health department finalized the regulatory changes in April 2017. So this had the effect of a couple of things. One, local health department clinics, such as the New York City Health Department sexual health clinics, were now required to provide HIV diagnosis and treatment, including prevention services, such as PEP or PrEP, either directly or by referral. Also, providers, both in our sexual health clinics and across the city, may administer these services to minors without parental or guardian consent or notification. So as of April 2017, when these regulatory amendments were finalized, in New York State, minors can consent to HIV prophylaxis and treatment. They have the capacity to consent, and those services be indicated without involving their parents or guardian. And obviously, both the New York State and City Health Department encourage open communication between young people and their caretakers. But for those for whom that presents a challenge, we certainly are very excited to allow young people to consent to their own prevention and treatment as needed. Importantly, and it's something we continue to work on, the release of medical and billing records containing information regarding these services may not be released to a minor's parent or guardian without that minor's express consent. So we want to make sure that any kind of documentation of young people consenting to these services and receiving these services does not make it to their parent or guardian without them providing consent to begin with. So it's something we continue to work on. In New York State, we are exploring ways to do that, both here at the health department and at the state health department as well. So I always say no law, no policy is worth anything unless people know about it. So that was an important next step. We wanted to make sure that we got the word out about these important changes, particularly to communities that would benefit from it, particularly to young people. So just a couple of promo efforts that we launched in a couple months after the regulatory amendments were finalized. The City Health Department issued a memo to all of our sexual health clinic staff requiring them to understand that minors may consent to HIV prevention and treatment without parental or guardian involvement. A couple months after that, the State Health Department released a Dear Colleague letter and an FAQ on the policy changes over the last couple of years, including those changes that grant minors this right. A month after that, the Health Department released 2 guides on payment options, one for adults and adolescents for PrEP. And we also the state released an HIV testing toolkit, which includes all sorts of resources to support routine HIV testing for adults and minors. And this included information about the PrEP for adolescents and treatment for adolescents. And lastly, the State Health Department in June of last year released a fact sheet and an FAQ on all of the legislative and regulatory changes related to HIV testing, reporting, and confidentiality, and also had a webinar for the public on the changes. So we continue to work to promote this change to not only young people, but their providers. We continue to do our PrEP and PEP detailing campaign here in New York City. Essentially, that's one-on-one educational visits to providers. We've reached more than 2,500 providers across the city at over 1,300 clinical sites. And we make sure that in the course of these visits, it is made clear that young people can consent to PrEP and other prophylaxis as well as HIV treatment without the involvement of their parents or guardians. I do want to mention one important way we've implemented PrEP for adolescents across New York City. In 2016, clinical and non-clinical providers across the city came together to create what we dubbed the PlaySure Network for HIV Prevention. So this includes medical clinics, frontline staff, community partners. They're working together to ensure that priority populations here in New York City have access to services, including HIV testing, PrEP and PEP, and HIV treatment. So they work together to collaborate to promote patient-specific approaches to sexual health, and also, importantly, to increase access to PrEP and PEP for people, particularly those without insurance and those for whom PrEP is indicated, may be indicated. Right now, the PlaySure network includes 55 contracts across the city, which is really exciting. It continues to grow. And lastly, I want to highlight one of those contracts, one of the sets of contracts. We're very excited since 2016 to have launched our PrEP for Adolescents initiative. This is a program that is designed to engage adolescents at risk for HIV in biomedical prevention services, and that includes risk screening, education, clinical care. These programs also provide support services and patient navigation to adolescents at risk for HIV, and the goal is to reduce the behavioral health, structural, financial, and psychosocial factors related to HIV risk. How are young people coming to them? Referral sources include existing clients at the 3 sites that we awarded the contracts to. Our sexual health clinics, we have 8 currently across New York City, and they act as referral sources to these 3 adolescent PrEP sites. We also have our Play Short network sites. As I mentioned, we have 55 contracts across many sites across the city. And we also have outreach events and social media campaigns that our contracted PrEP for Adolescent sites have launched to really get the word out about the services they offer. So not only do we fund dedicated staffing for patient navigators and benefit specialists, we also have identified those 3 sites to carry out these services. We have Montefiore Medical Center in the Bronx, La Casa de Salud in Bronx, and New York Presbyterian Hospital in Manhattan. Our staff provide technical assistance and capacity building efforts. We have trainings on benefits navigation, social media outreach, which is a major component of this work, sexual history taking, and intimate partner violence. We have ongoing Play Short network provider meetings, learning collaboratives, and we also have staff dedicated to assisting the PrEP for Adolescents sites to make sure that they're addressing any of the needs that they have. They obviously have access to all of our other Play Short network sites through our Play Short network directory and our New York City Health Map, which is an online portal where you can locate providers in any area. So we're very excited to continue to support our 3 PrEP for Adolescent sites. And I will say that we funded these programs, and these programs were implemented even before the regulatory changes that I described. But now that the changes are out there, they are doing better than ever, thriving, the 3 contracts. So much that in last calendar year, the First Lady's Office, the Unity Project, which is a citywide initiative to ensure the health and safety of LGBTQ youth, identified this initiative as something that they would like to fund, and we received additional funding from the First Lady's Office to expand our PrEP for Adolescents program. So we're seeing really excellent things from our sites, and we look forward to continuing to support them.
Okay, great. Thank you for that wonderful
It's a lot,
overview. Yeah, that was great. So I know that a lot of people will say that San Francisco and New York City are special cases. Do you think that other jurisdictions could replicate some of the successes you've had with these regulatory changes?
Sure. Well, I always say that the first step is to do a sort of inventory, a policy inventory. What are the laws? What are the regulations in your jurisdiction? And in New York State, HIV laws are matters of state purview. So we look to our state laws to determine what services, including testing, prevention, treatment, are offered under the law, and to which populations they're offered, who has access to these. So I think that's the first step. And I will say, I think New York was one of the last states to explicitly grant the right to consent to these services to minors. So I think once jurisdictions have a solid understanding of what the laws and policies in their jurisdiction allow them to do, then you can develop a strategy. If it's a legislative change that you're looking to do, it's important to outline exactly what you'd like to happen, whether it's introducing new legislation or proposing to amend existing legislation, and then identifying elected officials who can serve as champions for this. We are so lucky in New York State to have the most incredible, accomplished, and tireless advocates anywhere in the world who have really been leading efforts not only around PrEP for Adolescents, but around all of our HIV-related policy advocacy in the last couple of years. Everything stems from their energy and their expertise. And so developing a community, to organize your community, to really get behind specific policy changes is important. And then working with them to identify elected officials to really champion some of the work that you're doing and see what they can do. Obviously, if this is local legislation you're trying to change, city council members or local officials would be best. If it's state legislation, as it was in New York, it's identifying your state senators, your state assembly members, and of course your governor's office to make sure that they're behind the changes. And also tailoring all of your work to resonate with your intended audience, I think is very important. How you present a proposal to us at the New York City Health Department is very different than how you might present a proposal to your city council members or to your state elected officials, certainly to your governor. And I think it's important to make sure that your message resonates with them and can benefit everyone involved. After that is just being very deliberate and committed to this, making sure that you see it through all the way. You have to work within legislative sessions and the calendars. You have to figure out timing for this. Sometimes you might want to align with other issues that you can push forward as a set. Other times you want to distance yourself from other issues, depending on what the sort of political landscape and climate is at the time. So that's the sort of the legislative strategy. If in fact, like New York State, you see that advocacy through regulations, through your codes, your state codes would be best, then it's a whole different strategy making process. You want to obviously have allies at the state health department or the state agency that is overseeing the changes to and finalizing of any kind of regulatory activity. So again, make sure that your ask is very specific, figure out what needs to happen, how it needs to happen, present all this to those that have the authority to make it happen. And then I always say, make sure people know about it. Celebrate your success. Once it happens, it's something to pause, to take pause and realize you've done some good. But it's also as important to make sure that you get the word out there. Law changes need to go beyond legislators and those policymakers. They need to really reach the populations that are affected by this. In this case, we wanted to make sure that young people, in particular, young people who are increased risk for HIV, know all of this, and we want to make sure we're reaching their providers. So, in addition to all of the FAQs and Dear Colleague letters, the City Health Department, we've also been doing lots of presentations and workshops to our public school system. So we have been presenting to our school-based health clinics to make sure that providers there, the medical doctors, the nurse practitioners, as well as peer educators and health resource room staff understand what the current legal landscape is. They need to know exactly what young people, students in their schools, what they have access to. So that's important. We've also been working with our Administration for Children's Services, which is our child welfare agency here in New York City. Obviously, young people involved in state custody settings are at in New York State are at increased risk for HIV infection. So we wanted to make sure that we were reaching young people in foster care settings and in juvenile justice settings, as well as their providers, to make sure that this is something they know to which they have access. So that's important too. So promotion of it, and something we've been meaning to do for quite some time is to get the word out beyond your own jurisdiction, so that other jurisdictions can follow suit. It's really important to share resources and strategies, and to have conversations about what worked and what didn't work, obviously, and help other jurisdictions move along in that way, for sure.
So you talked a little bit about the importance of involving community in your answer. Could you tell me about how you involve community in the steps of both developing these regulatory changes and then implementing them and implementing
Sure.
or ending the epidemic plan at the city level?
Sure. So the New York State Ending the Epidemic Blueprint, that was something that was the product of a whole array of stakeholders. So we had not only health department staff at the city and state level, and not only members of local and state government, but completely driven by community members. These were recommendations that were drafted based on the lived experiences of community members affected by HIV. So it is an excellent document and has really acted as a blueprint, essentially, for policy activity. So all of what we have been doing was planned out for us by the community and government members that were on this task force that drafted the document. So as we continue on, as the epidemic as we continue our efforts to end the epidemic, we continue to draw from the expertise and experiences of our HIV planning group, of our Ryan White Planning Council, of our New York Knows, our HIV testing initiative that really is our largest community engagement arm. The state, too, continues to convene ending the epidemic regional committees to make sure that the work doesn't stop when you produce a set of recommendations. We want to hold ourselves accountable to implementing them. So it's an ongoing feedback loop of community members sharing what we should do and how we should do it. And frankly, that we should do it more quickly and more efficiently. So we always welcome all that information. Nothing we do here at the New York City Health Department happens in a vacuum. Everything is informed by community advocacy. And I don't just mean program planning, I mean policy advocacy as well. Last summer we convened the first ever HIV STI policy advocate group, a coalition. So we wanted to make sure that we were bringing into the room and raising the voices of our counterparts in the community, the individuals that work on policy, that work on legislation, so that we're all on the same page and that we can really take advantage of this exciting moment in time where we have the scientific advances, we have the community advocacy, and then we have the political will, which means funding, to really get a lot of this done. So we want to do as much as we can, as quickly as possible, and that means making sure that community and government are on the same page.
Great, thank you. So do you have any advice for people in jurisdictions where the political will may not exist yet, or maybe for more conservative jurisdictions where the will to do something about this just isn't there yet? Yeah, it's
tough, and a lot of this we don't take for granted for 1 minute that we can do this. Obviously, there are states that haven't expanded Medicaid, and that is a more pressing, more urgent challenge than, say, expanding some of the HIV-specific laws and policies that we've had the luxury of working on. So I think it's a matter of sharing resources, figuring out what worked for other states, what didn't work for them, and really looking towards your elected officials to see if this is something that they can champion. As I mentioned, it's with our elections last November, it's a whole new Congress. A lot of states had some major changes as well in the makeup of their state senates and houses or assemblies. I think that all bets are off in a sense. What didn't work before might work now. Certainly in New York State with the Democratic-controlled Senate and of course the Assembly, we as in New York State have managed to push through a lot of legislation that didn't get further than the Assembly in recent years. So it's about sort of just redoing that inventory, seeing what the state of HIV-related policies are, and then identifying champions for that. More than anything, I think it's about storytelling. It's about packaging proposals. I think that no politician, regardless of political ideologies, is going to be particularly enthused by a request for resources, for more money. If you explain why you need the money and how other jurisdictions have used that money to great results, then that might help. Making sure people understand that HIV is not an issue of simply communicable disease. It's one of you have to factor in social determinants of health. It's one that disproportionately affects different communities in different ways, and that this is something that has to be brought into the conversation. So I think identifying other ways to communicate your asks I think is important. Research them, look at their voting records, look at what pet issues they've had in the past, what interests they've had. I think those are way-ins, and build relationships with their staffers, I think is really important as well. Oftentimes they are the ones that are the entry point to some of these elected officials, and it's important to go that route.
Great. So do you have any last thoughts you want to share about New York City's efforts?
No, thanks again for allowing me to share some of this work. We're really happy with it, and it's a real example of from policy to practice, I think, because we've seen the policy change really inform some of the programming that we've been lucky enough to launch and to sustain. So I'm available if people want more information on our blueprint, on our specific PrEP for Adolescents contracts, and their performances and all of that. I'm happy to share all that as well.
Great, thank you so much.
Thank
for
you.
joining us, Adrian.
Of course.
It was great having you. Thank you for sharing all the wonderful information. And thank you all for joining us. We'll see you next time.
Thank you.